Your pregnancy test is positive and you don't want the pregnancy. You want a medication which can end the pregnancy early, and that too at home. You want to take an MTP kit. Is it safe, or taking the MTP kit at home can turn dangerous? Do you know many women take the MTP kit directly from the counter, that is in our language we call as over the counter, directly from the chemist or a druggist? And while in most of the cases they do not cause harm, but in some cases they take an unexpected turn. They do not know what dose to take, how much to take, what are the complications, when to turn to doctor. Hi, I am Dr. Rajat, and in this video I'll take you to the details of an MTP kit. How does an MTP kit work? Why MTP kit fails? What you should do before taking an MTP kit? When you should visit a doctor for an MTP kit? By the end of this video, you will definitely know what is MTP kit, what is the mechanism of MTP kit, what are the possible complications of MTP kit, how to mitigate and prevent those complications, and why you should visit a doctor before an MTP kit. Keep watching video till then. I'll give you a bonus tip. Hello, I am Dr. Rajat, and you have started watching our YouTube channel, The Fertility Gynecologist. Many women come to us after taking the MTP kit from the medical store. We get at least 50 to 60 women per year who directly come with the history of increase in menstrual flow. They do not tell us whether they have taken the MTP kit or not. And on doing an ultrasound, that is when we find out that this female has taken an MTP kit outside. The purpose of making today's video is to clarify most of the doubts, to tell you the details why an MTP kit should always be taken under the supervision of a doctor. Before that, I'll cover 10 most important queries, and then I'll go into the details of the video. 10 most important queries which most of the females have while taking the MTP kit. Query number 1. How to use an MTP kit step by step at home. Now, while I, as a medical practitioner, gynecologist, I would not recommend to take the MTP kit directly at home without the supervision of the doctor. But like I mentioned before, many women come to us, they take the MTP kit at home directly. So just to create an awareness, MTP kit contains 5 tablets. 1 tablet, single tablet, is a mifepristone tablet, and 4 tablets are misoprostol tablet. On that kit, it is written that you take mifepristone tablet on day 1. After 24 hours, you take 2 tablets of misoprostol, and then 24 hours after that, you take again 2 tablets of misoprostol. Now, I, as a gynecologist, have been working since last 20 years. This is an absolutely wrong mechanism or method of taking an MTP kit. Russell Ecolf, he discovered this molecule way back in early 2000s, and according to him, when he discovered this mifepristone, it is a progesterone antagonist, and initially when the MTP kit was discovered, the progesterone antagonist, it was given a 600 milligram tablet. Nowadays, after few years of research, people found that 200 milligram mifepristone works equally well as a 600 milligram tablet, so people have started giving a single mifepristone tablet. This is a progesterone antagonist. It basically, what it does is it stops the blood supply around the baby, and for its action to take place, we need at least 48 hours after mifepristone to start the misoprostol. So first things, what is written on the MTP kit is not true according to me. Ideally, you should wait for 48 hours after giving the tablet mifepristone, and then misoprostol. Those 4 tablets of misoprostol which are there, I normally prefer to give 2 tablets vaginally and 2 tablets orally at the same time, rather than giving it after some time. So this is one of the most important queries, how to take the MTP kit. Again, like I mentioned, I normally in my practice slightly differ it, and I'll come to it in the later part of the video once I complete this FAQ section. Second question is MTP kit side effects and how to manage them. Now you have to understand that mifepristone is a progesterone antagonist and misoprostol is a prostaglandin analog. Mifepristone will decrease the blood supply around the baby, while mifepristone may not have any side effects. But when you take misoprostol, because misoprostol is a prostaglandin, the action of misoprostol on uterus is to increase the contraction of the uterus and to expel the products of conception out. Now, while we are giving the misoprostol for this expulsion, it has got its own side effects. Misoprostol can cause nausea, vomiting, diarrhea, pain, fever, rigors, abdominal pain, and bleeding. While bleeding is an anticipated side effect because we are taking the MTP pill for the abortion purpose, all other side effects can occur. How to mitigate those side effects and what to take for those side effects, I'll come later on in the video. The third most important query is what to do if bleeding doesn't start after MTP kit. This is the most commonest question and most common thing by which the patient comes to us, they have taken the allegedly they have taken the MTP kit from outside, and the bleeding does not start. See, in an ideal world, I always tell the patients an MTP kit should always be taken under the supervision of a gynecologist. Gynecologist is the best judge to administer a MTP kit, because there are certain cases in which MTP kit should be given, MTP kit should not be given. The dose of MTP kit, the dose of mifepristone, the dose of misoprostol, they all vary. Again, I am giving a disclaimer. This video is meant for a medical purpose only. Please do not take MTP kit at home without supervision of a gynecologist, and chemist or druggist is not the person to guide you to take an MTP kit. So if the MTP kit does not lead to bleeding, please visit your gynecologist, that he or she would do an transvaginal ultrasound to find out A, first of all, pregnancy is there, B, if pregnancy is there, how big it is. If pregnancy is more than 10-11 weeks, there is no point of taking an MTP kit. Most of the times what happens people take MTP kit directly by doing an urine pregnancy test done. Sometimes there is a false positive urine pregnancy test, sometimes there is a chemical pregnancy. The pregnancy might not be there and you might not have the bleeding. So there are many causes of bleeding not occurring after MTP kit. So the first step, if the bleeding does not happen, please visit your gynecologist. Fourth question is MTP kit doses and timing chart. I have explained. Normally, whenever you take the first tablet of mifepristone 200 mg, you have to start misoprostol. You have to wait for at least 48 hours after taking the mifepristone, because the action of mifepristone takes 48 hours. It primes the uterus. It separates the gestational sac from the myometrium. When the embryo has implanted, it acts as an anti-implantation agent, and for its action to be over, to take complete action, and misoprostol acts on a mifeprim primed endometrium, so we have to wait for at least 48 hours. What are the signs of incomplete abortion after using an MTP kit? Many females, when they think MTP kit, the bleeding has occurred, they think that the pregnancy has gone, and then they continue on with their own merry ways, they continue on with their lives. But sometimes the pregnancy has not completely evacuated. Normally, if pregnancy is small, there would be less bleeding. If pregnancy is big, say 7, 8, 9 weeks, there would be relatively more bleeding. If it is very early pregnancy, small gestational sac 2, 3, 4, 8, 9, 10 millimeters, then the bleeding may not be more. So as a non-medical person, you may not be able to know whether the pregnancy has been evacuated completely or not. So to know whether the pregnancy has been completely evacuated or there is a signs of incomplete abortion, you have to go for an ultrasound. Continuous bleeding over a period of 15, 20, 30 days, with some days there is a passage of blood clot, some days there is passage of yellowish cheesy material, or with pain, foul smelling discharge. These all are signs of that pregnancy has not evacuated completely. The price of MTP kit and where to buy. This is the most important thing. The price generally printed on the back of the MTP kit, the maximum retail price is about somewhere between 450 to 500 to 700 rupees. Again, there are various companies in the market who have come up with the MTP kit. We as doctors, because we use various products of various companies, we know which product works best. Not every product which is cheap would work best. Not every product which is highly costly would work best. But we, over a period of our experience from our use, we know that this company's products works best and this company's products do not work best. So again, I would recommend MTP kit has always to be taken under the supervision of a gynecologist only, not under the supervision of a chemist or not directly. How many days of bleeding after taking the MTP kit? This is again a very important question. Normally, when MTP kit came first into the market, it was said that most of the bleeding occurs at least up to 12 to 15 days after. 12 to 15 days, because even if the product is evacuated, there is a raw area inside the uterus and that bleeding would continue. When we were first taught about the MTP kit, we were told that patient has to come after 15 days for follow-up, but I follow a different practice. Again, I'll come to it later part of the video, but most of the bleeding occurs for 15 to 20 days. Which are the diet and the precautions after taking the MTP kit? Normally, mifepristone, if you take it, it does not have any relation with the diet. You can continue with the normal diet. But with misoprostol would cause nausea, would cause vomiting, sometimes it would cause diarrhea, it would cause vomiting, it would cause abdominal pain. So what I advise my patients when you take misoprostol for 4 to 6 to 8 hours, be on light diet, don't take a heavy meal, be either on fluids or very light diet and minimal diet, so that you do not have more problems. What is the difference between an MTP kit and a morning after pill? Now, MTP kit is basically for clearing the pregnancy which has implanted, And morning after pill is an emergency contraception measure. If you have had an unprotected intercourse and then you don't want the pregnancy, then within the 72 hours of an unprotected intercourse, you take a morning after pill or an I pill. These both are different. I pill or morning after pill would prevent the pregnancy, while an MTP kit would dislodge an already existing pregnancy. And last question, which is most popular, most people ask me, when to take a pregnancy test after MTP kit. Now this is very, very, very important. MTP kit would dislodge the pregnancy, but the beta HCG hormone, which is reflected in the urine pregnancy kit, would still remain in the body for about 7 to 10 days. Please understand, the beta HCG or urine pregnancy test would not come negative immediately after the bleeding. It would take 7 to 10 days for it to come negative, and even it may not come negative directly. First of all, from dark positive it may go to faint positive, faint positive, and then slowly it may become negative. This is very, very important. Please do not waste your money on unnecessarily doing urine pregnancy test. It is better you visit a doctor, get a transvaginal ultrasound done, and to check whether the pregnancy has been completely evacuated or not. So these were the 10 most common questions which people ask, and that is why I decided to make a video. Now let me come to the details. MTP kit is available from various companies. We normally prefer certain standard companies, and from the mechanism of action, like I have already told you, mifepristone acts as an anti-progesterone. It basically dislodges, or it separates the pregnancy from the myometrium, and misoprostol, it basically increases the uterine contraction, and because of that contraction it acts on expelling the pregnancy out. So how do I get MTP kit? Normally I prefer, rather than 1+4 regimen, I prefer 2+6 or 2+8 regimen. I always believe it is better to give 2 tablets of mifepristone followed by misoprostol 48 hours. I give misoprostol 2 tablets vaginally, 2 tablets orally, followed by 2 tablets orally. That means 600, 200 plus 200, that is 400 plus 400 plus 400. So I normally prefer 200 milligrams misoprostol, but that may vary according to the patient. Now first and the most important thing in this video, MTP kit does not have to be taken directly by simple doing urine pregnancy test positive, because urine pregnancy test positive may also be positive in HMOL. It may also be positive in ectopic pregnancy. It may also be positive in a chemical pregnancy. First of all, you have to diagnose the intrauterine pregnancy. You have to rule out the ectopic pregnancy. You have to rule out the chemical pregnancy. You have to rule out HMOL. If and only if urine pregnancy, intrauterine pregnancy is documented on a transvaginal ultrasound, then and only take ectopic pregnancy. Because if you take MTP kit without doing an ultrasound, and God forbid there is an extrauterine pregnancy or an ectopic pregnancy, if you happen to take MTP kit, there is a possibility that tubal rupture may occur, and that may lead to a life-threatening illness. Now government has made it mandatory that MTP kit has always to be taken on the prescription of a gynecologist only. Please do not take MTP kit without a prescription directly on over the counter. Why? Because few years back, a female in Chennai took an MTP kit directly from a gynecologist. She had bleeding. She thought complete pregnancy was gone, but that bleeding continued for a couple of months. And because that bleeding continued for a couple of months, she did not go to a doctor. Her hemoglobin level fell very low, and she ultimately expired. So this is very, very, very important, because what happens is sometimes, well, you may think that bleeding has occurred, but even there is sometimes the pregnancy does not separate completely. It might separate slightly, and there would be bleeding while giving, and it may give you a false sense of confidence that pregnancy has been gone, while in fact there the pregnancy is still there. And because some pregnancy is there, the action of uterus would be to keep on contracting. So you may have slight bleeding. The more the pregnancy separates, the more bleeding would there. Any foreign body in the uterus, uterus would try to evacuate it, and that is why the bleeding keeps on happening. So you have to immediately visit the doctor if the bleeding keeps on happening for more than few days. Sometimes between these 48 hours after taking the mifepristone, before misoprostol, bleeding occurs. So people come to me and call me, then they ask, still do we have to take the misoprostol? Answer is yes. Complete course of MTP pill has to be taken. Misoprostol has to be taken to evacuate whatever the products of conception may be. Now side effects are very, very important. I always tell my patients, you will have nausea, vomiting, diarrhea, pain, fever, rigor, abdominal pain. Either you may have few of them, or you may have couple of them, or you may have 1 or 2 of them, or you may have all of them. Because misoprostol is a PGE1 prostaglandin E1 analog, it leads to these complications, but these are self-limited. They are limited for about 4 to 6 hours only. And most of the females who have undergone normal delivery, they are able to tolerate these side effects well. If the female is not able to tolerate the side effects, if the female is not able to tolerate the bleeding, diarrhea, then I tell that you take a tablet, Combiflam. Now people might be wondering, why Combiflam for diarrhea, why Combiflam for vomiting? In fact, these are the side effects of prostaglandins, and Combiflam is an NSAID, non-steroidal anti-inflammatory drug. So if it inhibits the cyclooxygenase system in the body, it inhibits the action and secretion of prostaglandins, and that is why for all prostaglandins related side effect, you have to take an NSAID, either Combiflam, or if you cannot take anything by orally, you can take a simple diclofenac injection. Most of the problems would get solved. But Combiflam or this diclofenac or Voveran injection should not be taken for mild side effects, because a drug, if it has an effect, it will also have side effect. If you suppress, there is no drug which can only suppress side effect, but the effects would remain, so the effect would also decrease. So if you take Combiflam or Voveran early, there is a possibility that there might be retained products of conception. Now, I am always again many times repeating in this video that this MTP pill has to be taken under the supervision of a gynecologist after getting an ultrasound done. People might be wondering, this doctor is calling the patients for money for doing an ultrasound. No, answer is not that. Whenever we are doing an ultrasound, we see 4-5 things. If there is a bulky uterus, if there is a gross adenomyosis or an adenomyoma, if there is a fibroid, if there is a previous section case or previous 2 section case and the pregnancy is implanted around the scar, if there is a multiple times history of miscarriages, if there is multiple times history of DNCs, then the chances of the success by using an MTP kit decreases drastically. And we also know the size of pregnancy. If there is more size of pregnancy, then the more misoprostol doses needed. This is very, very important, that ultrasound should be done. And like I mentioned, you have to rule out the extrauterine and ectopic pregnancy and an H-mole also, and you have to see whether there is a chemical pregnancy. Sometimes if there is a chemical pregnancy, you don't need to go for an MTP kit. If we have given MTP kit, if there is no bleeding and there is a documented intrauterine pregnancy, then there are 2 options left: either to go for a dilatation and curettage suction evacuation surgical MTP, or we go for a repeat MTP kit. Now, in my practice, if the patient is a primary patient or patient wants pregnancy later in her life, I always prefer to go for a repeat course of an MTP kit, especially if patient has taken MTP kit from outside. I normally give the MTP kit from my side. I personally store MTP kit in a refrigerator between 4 to 8 degrees centigrade. This is very, very important. And I have, while the books say that it can be stored at room temperature, unfortunately in a tropical country like in India, I have observed that if misoprostol is kept outside at a room temperature, the efficacy of misoprostol slightly decreases. Over last 20 years, I have made it a habit, a rule in my hospital, that MTP kit has to be kept in refrigerator. And once that MTP kit is kept in refrigerator, the efficacy increases. Even at home, I ask my patients to keep the misoprostol tablet in the refrigerator only. So I repeat the course, and after repeating, in about 50 to 70% cases, there the bleeding occurs and the pregnancy is complete. The success chances of MTP kit, if the patient has not undergone an abortion any time before, patient has not taken MTP pill any time before, there is no fibroid, there is no adenomyosis, there is no previous section or previous 2 section, in those cases, the successful evacuation of pregnancy by an MTP kit is about 87 to 94%. This is very, very important. Now, if the patient, when do you call the patient of an MTP kit for a follow-up? Normally, I give 2 tablets mifepristone. After 48 hours, I give 2 tablets misoprostol orally and vaginally, and after 2 hours, again I give 2 tablets misoprostol. That day, the patient may have bleeding, and then I call immediately the next day. At that point of time, if the pregnancy is evacuated, it is fine. If there is still some clots, some products of conception, then I can again repeat the misoprostol 2 tablets, either 3 times a day or 4 times a day for 1 or 2 days to increase the products of evacuation, and I found more success in many cases. Why I call immediately and why not after 15 days? Because immediately, if the bleeding is continuing, the tissue might be wet, and if I have to give an increased dose of misoprostol, that it may work. If I wait for 15 days, if the tissue dries and it starts forming polyp, then the medical evacuation may not be possible, and that is why an early follow-up is necessary. If the patient has come to me after 4 days, normally what I see is, I see the endometrial thickness, and the endometrial thickness after the evacuation has to be about around 8 millimeter. If it is more than 8 to 10 millimeter, then I again give misoprostol for a couple of days. If it is more than 20 millimeter, then I say that there is a chance that you may require a dilatation and curettage or a check curettage. But I normally avoid and refrain doing dilatation and curettage. What I do is, because MTP pill after 15 days will still cause bleeding. If there is an remaining endometrium for about 8, 10, 12 millimeter, I start the patient on an oral contraceptive pill for that month. Oral contraceptive pill, what it will do is, if there is an 8 to 9 millimeter, 10 millimeter, 12 millimeter endometrium still left inside, rather than doing MTP or a check curettage, I give oral contraceptive pill. Oral contraceptive pill would start forming, because of the estrogen content, it will start forming a new endometrium beneath that and after 4 to 5 days after taking the oral contraceptive pill, the bleeding would decrease drastically. And after completion of that course of oral contraceptive pill, there would be a withdrawal, and during that withdrawal, whatever the latent products of conception, they may come out naturally. So that means that you do not have to do dilatation and curettage or a check curettage in every MTP pill failure. If there is a definite pregnancy, then yes, you may think about it. But if there is only an endometrium or certain blood clots, you do not need to go for a dilatation curettage. Because I am doing an infertility practice, because many of my patients, they want pregnancy in future, I firmly believe in a process of a surgical evacuation. While you are dilating the cervix, while you are curating the endometrium, there is an inadvertent damage to the endometrium or to the cervical crypts, which might decrease the spontaneous conception chances later on in the future. So it is better to try maximally for an evacuation by an MTP kit rather than going in for a surgical evacuation. While the old timers gynecologists, they always believe that surgical evacuation is best. Even many people run away from my OPD whenever I tell them that first evacuation would always be by a medical method rather than surgical. I try maximum that it should be evacuated by the medical methods only. Many times it so happens patients do not come to us after follow-up for 4 days. They think bleeding has occurred. Why necessarily waste for a consultation for 200, 400, 500 rupees? And then they come back to us after 15 days, 20 days, either with complaint of continuous bleeding PV or with complaint of intermenstrual bleeding. The bleeding sometimes occurs, sometimes does not occur. Like I mentioned before, why we call on 4th day or 5th day after MTP pill is that if there is still some amount of RPOC there, we can give either misoprostol or an OC pill so that it does not dry it out by itself and forms a polyp. If it dries out and forms a polyp, then it will lead to an intermenstrual bleeding. While that may not be an acute problem, but that may disturb the patient. The cycles may get disturbed. The maximum amount of time, the number of weeks at which you can give MTP pill is 9 weeks or 63 days of pregnancy. If you are doing it without an ultrasound, again I would always insist, please do not take MTP kit without the supervision of a gynecologist. While it may not harm in 9 out of 10 times, but one time it may harm you, and that may be life-threatening. So at the end of this video, I would like to tell 4 important carry-home messages. A, whenever you have a missed period, if you find urine pregnancy test is positive, please visit to a doctor and confirm whether A, it is a chemical pregnancy, B, it is an intrauterine pregnancy, and C, rule out the extrauterine pregnancy. If you do not desire to continue the pregnancy, if you want an evacuation of pregnancy, you ask your doctor, and your doctor would be the best judge to give you an MTP pill. If doctor has called you for a follow-up after 4 days, 5 days, 7 days, please do visit the doctor, because if you do not go for a follow-up, there is a chance that you may either keep having the bleeding, or there may be a chance of polyp occurring in the future. And last, please make it a habit. Do not take MTP pill again and again and again. Once mistake is pardonable, but the moment many people I encounter that they take MTP kit at least twice or thrice or 4 times in a year, I always tell them, once an MTP kit has been taken, mistake once is fine, but after an MTP kit, please, if you do not desire a pregnancy for 6, 8, 10 months, 12 months, 2 years, 3 years, go for some method of a contraceptive planning. And for us gynecologists, most of the young females are a perfect candidate for an oral contraceptive pill, because the success chances of oral contraceptive pill in preventing the pregnancy is about 99.95% rather than OC pill. And condom or a barrier method of contraception, according to us medically, is not a method of contraception, it is a method of safety, and 1 in 6 cases of condom usage leads to the failure. Hope you like the video. Please share the video, please subscribe to our channel, and also in the comment section please write on what further topics you would want a new video. Thank you, bye bye.